Tracy, tell us a little bit about what happened to you and how you managed to end up coming into this program.
Okay, well, May of 2008, I was a paramedic and firefighter and a fire chaplain, and while working my medic job, I was transporting a patient in gurney collapse, and the patient was over the gurney weight in excess of 600 pounds, and I did a second transfer after that. Ultimately discovered my shoulders had both been dislocated and I had multiple injuries in my back.
Okay. So did it require any sort of fusion or back surgeries?
Yes,
Okay.
I had a complete lumbar fusion last May. I've had 3 kyphoplasties. I've had multiple back and neck injections. There's a discussion of the probability of putting a fusion in my neck and connecting the neck piece with the low back piece by way of a rod.
Okay. And then how did all this affect your lifestyle, your relationships at home? Tell me what was going on there.
Oh, it completely turned my life upside down. I was newly engaged. My husband now, former fiance, and I were very happy. We fished competitively in a local semi-pro bass club. I was just invited to join the professional women's league. We were very active in social organizations, lodges, and really big community people, outdoor people. We camped a lot.
And then what happened?
It totally changed our lifestyle. It all came to an abrupt halt. I literally ended up 90% bedbound. Just after that, we lost a baby, and a series of other events occurred. My family moving away, getting distant with them, the injury and illness making it to where my family no longer knew how to communicate with me,
Okay.
much less my husband, for that matter.
Okay.
I can no longer do housework, participate in wifely duties,
Okay.
and it all led up to me attempting to take my life last April.
Okay.
And to my surprise, I woke up the next day. How I did, I don't know,
Okay.
but I think there was a reason I did.
And then you sought help for that shortly thereafter?
Actually, I'd been begging for help for
Okay.
a long time. I'd been
Okay.
begging the doctors to get me into some type of therapy program. I knew that just laying in bed was not the way to
Get well.
get my quality of life back. No, I knew that that was only hurting me, that would not help me.
Okay.
I'd been begging for therapy. I had been begging for any type of physical activity. And
Now you and your husband had been starting counseling, is that right?
yes, we began counseling after my suicide attempt.
How long had that been going on?
About 8 weeks.
Okay.
Until 2 weeks ago, so about
Okay.
10 weeks ago.
Okay. And then you finally got admitted into this program, and since you've been here, what have you noticed about your lifestyle, your outlook, how you're feeling physically and mentally?
Oh, yes, definitely, and it's something I surely want to talk about. My very first day here, very first day, I wouldn't even say the whole day, the first hour even, I learned more than I learned in the 8 weeks of therapy that I was seeing with a individual therapist and a marriage counselor. And this counselor also, by the way, was on the verge of having me committed for self-endangerment and, concerned due to my inability to do housework and things like that. He felt like that was becoming a dangerous situation at home,
Okay.
that I couldn't care for myself, and felt like that would be the only answer.
So you and your husband were pretty much on the rocks.
Yes, actually we were living separately at the time.
Okay.
Mm-hmm.
And now, has there been any changes along those lines?
Oh yes, after meeting you for the very first time, my husband had a total about face. Prior to that, he was actually, I kind of hate to say it, but He was emotionally and verbally abusive.
Okay.